Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, we will take an overview on the anatomical regions of the head and neck. This labels illustrates the major compartments of the head, which are the cranial cavity appear as a pink box. Two green boxes represents the air cavities. Two yellow cones represents the two orbits. Two blue boxes represent the two nasal cavities, and lastly the purple box which represent the oral cavity. As we see, the cranial cavity is the largest compartment that contain the brain and associated meninges. Most of the air apparatus on each side is contained within one bone that forms the floor of the cranial cavity, while the external parts of the ears extend laterally from the skull. The two orbits contain the two eyes. They are cone-shaped chambers that lies immediately inferior to the anterior aspect of the cranial cavity, and the apex of each cone is directed posteromedial, as we see, while the walls of the orbits are formed of bone, and the base of each cone of the orbit can be opened or closed by the movement of the eyelid. The nasal cavities are the upper part of the respiratory tract, lies between the orbit, as we see on the right label. They have walls, floors, ceilings, which are composed of bone and cartilage with each other. The anterior opening of the nasal cavities are called nares or nostrils. The posterior opening are called the posterior nasal aperture or the choana. Continuous with the nasal cavity, there are air-filled extensions called the paranasal sinuses. The paranasal sinuses project laterally, superior, posterior, into the surrounding bones. The largest one of these sinuses are called the maxillary sinus that lie immediately inferior to each orbit. We can see it on the right label as a green extension below the orbit. The oral cavity lies inferior to the nasal cavities, as we see. They are separated from them by palate. The palate includes a hard palate and soft palates. The floor of the oral cavity is formed of soft tissue only. The anterior opening of the oral cavity is called the oral fissure or the mouth, and the posterior opening is the oropharyngeal isthmus. Unlike the nares and choana of the nasal cavities that are continuously open, the oral fissure and the oropharyngeal isthmus can be opened and closed by the surrounding soft tissues. Besides the major compartments, we have two another anatomically defined fossae called the infratemporal and pterygopalatine fossae. The infratemporal fossa, this is the infratemporal fossa, lies between the posterior aspect of the mandible and the lateral plate of the cricoid process. It contains the mandibular nerve, which is a division of the fifth cranial nerve, the trigeminal nerve, and it passes in the infratemporal fossa on its way between the cranial and the oral cavity. The other fossa is the pterygopalatine fossa that lies posterior to the maxilla, posterior to the upper jaw. This small fossa communicates with many cavities: the cranial cavity, the infratemporal fossa, the orbit, the nasal cavity, and the oral cavity. It also contains the maxillary division of the trigeminal nerve. We have an anatomical area. This is called the scalp, that bordered by the face from the front and by the neck from the sides and back. This area covers the superior, posterior, and lateral regions of the head. The scalp is formed actually of 5 layers: the skin, connective tissue, the aponeurosis, the loose areolar connective tissue layer, and the pericranium or the periosteum. Before we talk about the compartments of the neck, let's know what are the extensions of the neck. The neck extends from the head above to the shoulders and thorax below. Its superior boundary is along the inferior margins of the mandible and the mastoid process of the posterior aspect of the skull. The inferior boundary extends from the top of the sternum along the clavicle onto the acromion of the scapula. The posterior neck, as we see, is higher than the anterior neck. To be able to connect the cervical viscera with the posterior openings of the nasal and oral cavities. The inferior limit of the posterior aspect of the inferior boundary of the neck is ill-defined, but can be approximated by a line between the acromion and the spinous process of the 7th cervical vertebrae. The 7th cervical vertebra is prominent and easily palpable. The inferior border of the neck encloses the base of the neck. The neck has 4 major compartments, which are enclosed by an outer musculofacial collar. The vertebral compartment that contains the cervical vertebrae and associated postural muscles. The visceral compartment that contains important glands, which are thyroid, parathyroid, and thymus. Also, this compartment contains parts of the respiratory and digestive tracts. The vascular compartments, 2, 1 on each side of the neck, and contain the major blood vessels and the vagus nerve.